Treatments. In the vast majority of cases, back pain resolves itself without medical help, just with careful attention and home treatment. Pain can usually be addressed with over-the-counter, OTC, painkillers. Applying a hot compress or an ice pack to the painful area may also relieve pain. Resting is helpful, but should not usually last more than a couple of days. Too much rest may actually be counterproductive by allowing muscles to weaken, which can lead to further episodes of back pain in the future. Usually back pain is categorized into two types. Acute, back pain comes on suddenly and persists for a maximum of 3 months. Chronic, the pain gradually develops over a longer period, lasts for over 3 months, and causes long-term problems. A considerable percentage of patients with back pain experience both occasional bouts of more intense pain as well as more or less continuous mild back pain, making it harder for the doctor to determine whether they have acute or chronic back pain. If home treatments do not give the desired results, a doctor may recommend the following. Medication. Back pain that does not respond well to OTC painkillers may require a prescription NSAID, nonsteroidal anti-inflammatory drug. Codeine or hydrocodone, narcotics, may also be prescribed for short periods. They require close monitoring by the doctor. Some tricyclic antidepressants, such as amitriptyline, have been shown to alleviate the symptoms of back pain, regardless of whether or not the patient has depression. Physical therapy, the application of heat, ice, ultrasound, and electrical stimulation, as well as some muscle release techniques to the back muscles and soft tissues may help alleviate pain. As the pain subsides, the physical therapist may introduce some flexibility and strength exercises for the back and abdominal muscles. Techniques on improving posture may also help. The patient will be encouraged to practice the techniques regularly, even after the pain has gone, to prevent back pain recurrence. Cortisone injections. If the above-mentioned therapies are not effective enough, or if the pain reaches down to the patient's legs, cortisone may be injected into the epidural space around the spinal cord. Cortisone is an anti-inflammatory drug. It helps reduce inflammation around the nerve roots. According to the Mayo Clinic, the pain relief effect will wear off after less than 6 weeks. Injections may also be used to numb areas thought to be causing the pain. Botox, botulism toxin, according to some early studies, are thought to reduce pain by paralyzing sprained muscles in spasm. These injections are effective for about 3 to 4 months. CBT, cognitive behavioral therapy, CBT can help patients manage chronic back pain. The therapy is based on the principle that the way a person feels is, in part, dependent on the way they think about things. People who can be taught to train themselves to react in a different way to pain may experience less perceived pain. CBT may use relaxation techniques as well as strategies to maintain a positive attitude. Studies have found that patients with CBT tend to become more active and do exercise, resulting in a lower risk of back pain recurrence. Subscribe us to know more health tips and home remedies.